Hey, thanks everyone for joining us for this Business New Zealand Workplace Vaccinations webinar. Hey, look, just want to apologise for Friday. Obviously, we had a few technical difficulties, so we've got to redo it. So thanks again for joining us and for your understanding and, of course, continued participation. The purpose, obviously, of today's webinar is to explain the vaccination program and how it will work. The expressions of interest process for business, the criteria for undertaking workplace vaccinations, and to give you the opportunity for questions at the end. Now I'd like to hand over to Beth Williams, who's the Engagement Manager for the Ministry of Health Vaccine and Immunisation Program. Welcome, Beth.
Thanks, Kirk. Hi, everyone. Thanks so much for giving up some of your Tuesday afternoon to join us on this session. Very much appreciated. Just give you a quick summary on where the program is at and how we're rolling out. We have delivered to date around 1.4 million doses, and we have just over 560,000 people fully vaccinated now. We have around 9,000 vaccinators fully trained, ready to go. And so that gives us great heart in terms of our ability to ramp up, which is the stage that we're in right now. We're very aware of the value of each of these little glass vials, which cause us a little bit of a headache in terms of transport, but are incredibly valuable. And so we are very focused on not wasting any of the contents of those vials. At the moment, we are using the stock of Pfizer at around 99.5% efficiency. So we're wasting less than 0.5%, which is pretty impressive. You probably all know the program that we're going through, the rollout process, using a priority system or a first application system based on risk level. So with border and MIQ import workers going first, and those people were notified through their employee, and there are about 50,000 people in that first group. The second group were those most at risk of catching COVID by virtue of where they live or where they work, and that included health workers, carers for older people or disabled people in residential care, and also the residents of those care facilities, and also people living in Manukau, since they've copped it whenever something is broken out of the MIQ situation. So there were about 480,000 people in that group. So, about a factor of 10 increasing there. And then the third group was those most at risk of getting sick should they contract COVID. That included older people, over 65-year-olds, disabled people, those with underlying health conditions. And there are about 1.7 million people in that group. They were generally contacted by the health system. So as long as they've had some interaction with a hospital or a DHB or a GP, then they would have been caught up in that, although we are aware that there are a few that aren't. And then we go into group 4, about 2 million people for the rest of the population. And the decision has been made to take those people in age bands. So we'll start at the end of this month with those over 60, and then look at progressively every fortnight or so rolling down to a lower age group. And there will be the ability for those people to book themselves in using an online booking tool or an 0800 number, as well as going through GPs and pharmacies. So you're probably aware that this is being led and run by the DHBs, and so DHBs do get through different groups at different speeds and have different numbers in each group. So there is some variability across the country on where they're at. We've been doing a lot of work just of late to really connect and upskill and make sure that they're well-informed GPs and pharmacies of late, because they'll be critical for group 4. So with all this capacity to ramp up in terms of the systems, of course, we need the vaccine to be able to do that. And there was a lot of excitement within health yesterday morning when we discovered that our biggest allocation of Pfizer had been delivered to us on Sunday night in the wee small hours. And that was, I think, around 370,000 doses. So that's certainly our biggest amount so far, and keeps us well on track to receiving over 1 million doses in July, with 1.5 million expected in August. So that will enable us to put in place the ramping up that we've planned for. And it is still our aim to have everyone vaccinated that wishes to be vaccinated over 16 years of age by the end of the year. We've done a little bit of sort of the equivalent of workplace vaccinations, and Josh will talk you through this in a little while, with the MIQ port and border workers. And from a comms perspective, the lessons that we've learned from that is that good, clear, concise information is key to giving people the tools to make their decision. We have lots of anecdotal evidence of a huge number of webinars that we did back in March and April for port and border workers, where we would have people walking into those webinars, which consisted generally of someone giving a bit of a background on the program, and then a clinician talking about how the vaccine could have been developed so quickly and still be safe, and have the fact that it didn't skip any of the steps in terms of approval process from MedSafe, how it works, what it contains, and what it, more importantly for some people, what it doesn't contain. And we know that a number of people went into those sessions saying there ain't no way I'm going to have this vaccine, and came away virtually rolling up their sleeves and asking if they could be injected right then, and more importantly going home and telling their whānau that that they ought to be getting vaccinated as well. So really good quality information is really, really important. And I think that's a role that all businesses can play. Not all businesses will be able to be a vaccination site, and Rachel will cover this shortly, but all businesses can provide their staff and their communities that they are existing in with really good information, and provide direction on the best places to go to get reliable information, and also how to recognise misinformation. So we're working hard at the moment to pull together a bit of a resource kit for business, so that they can and have those tools at their disposal when they're having the conversations with their staff. And you may think, why would managers need to have this conversation with their staff? Well, really research that we did said that people are very likely to ask their manager about getting a vaccination and what their thoughts are about it, and seek advice. So we're not expecting businesses to advise people on whether to get vaccinated or not. What we're asking them to do is to support their staff to make the decision for themselves by providing them with good information. And that could extend to contractors, as well as the wider communities that they are in, and that might include their suppliers or their customers, or the other bits of the community that businesses inevitably touch. So we are keen to work with anybody on this call that is interested to be involved in pulling that toolkit together, and any inputs and insights that they might have to make that more useful for business. And of course, we're interested in finding out whether there are some people on the call that could be potential vaccination sites, which is my cue to hand over to Rachel.
Thank you, Beth, and good afternoon, everybody. Thank you to Kirk and the team at Business New Zealand for hosting us, and thank you everyone on the call for giving up an hour of your afternoon to listen to us, and hopefully we can provide you with some useful information and answer your questions. I'm Rachel Mackay, and I'm the Director of National Contracts in the COVID-19 Vaccine and Immunisation Program at the Ministry of Health. I'm going to introduce the Workplace Vaccination Program, discuss requirements for participating workplaces and the eligibility criteria, and explain the EOI process. As Beth touched on, the Ministry of Health is working closely with district health boards to establish the best ways to offer the COVID-19 vaccine to a wide range of people living in different communities right across the country. Anyone in New Zealand is eligible to receive the vaccine free of charge, over 16. And as we move into what we call Group 4 in the sequencing framework, we need to be supporting the DHBs to really scale up. It's really important that we ensure we offer people the opportunity to be vaccinated in a variety of different settings at different times, and to make getting vaccinated as easy as possible for people. And one way of offering vaccinations will be in workplaces as part of this general population rollout. The focus is on larger workplaces, or workplaces with larger workforces, or workplaces with high Māori, Pacifica, rural workforces, as well as workplaces where it might be difficult for the workforce to find time to get vaccinated. So, for example, factories with shift workers, etc. So offering workplace vaccinations is going to help the program reach scale and access a wide range of people. It's not designed to replace the work that the DHBs are doing, it's designed to support and augment that work. To date, the Ministry has been working closely with occupational health providers to deliver vaccination services into particular workforces that are in Group 1 or 2 of the sequencing framework. For example, New Zealand Defence Force, Police, Fire and Emergency and Corrections. And Josh will talk about that in a little more detail, and the learnings that we've developed from that has helped to inform how workplace vaccinations are going to work best moving forwards as we move into the general population. We're also doing, very kindly, have the support from Fonterra and Mainfreight to do workplace, a couple of test sites with workplaces, and we'll be also working with the Warehouse and Fisher & Paykel Healthcare as well. We have worked with the business sector, occupational health providers and DHBs to develop a workplace model for vaccinations. That's the blueprint document that is on the Ministry website. But it's a living document. So what we will be doing as part of the test work that we're doing with Fonterra and Mainfreight is refining that document as we develop it. We've invited workplaces and vaccination providers to express interest in being part of the workplace vaccination as part of Group 4. And we've got eligibility criteria and requirements. Do want to emphasise that the EOI is literally that. It's just an expression of interest. It's the opportunity for you and occupational health providers or other vaccination providers to pop your hands up to say, hey, look, guys, we're interested in being involved here. It's not a commitment necessarily on your part or on our part. And I will talk you through how that process will work. It really is just an opportunity to say, look, we're interested in finding out a bit more. And we at the Ministry will be working jointly with DHBs to evaluate the expressions of interest. In assessing the potential for a workplace to become a vaccination site, a panel comprising Ministry of Health and DHB staff will have a look at a number of aspects: the number of staff the site has, how many vaccinations can be delivered per day, and how the workplace meets equity requirements of the program. So, for example, number of Māori or Pacific workforce, or if it's a rural workforce, etc. And I will go into that in a bit more detail in a minute. We can't deliver vaccines in all workplaces, so we're going to focus on those where workers don't have easy access to getting the vaccine through other ways, and workplaces where there is no nearby community clinic or it's hard for workers to access clinics will be the sort of sites that will be prioritised through this process. As Beth has touched on, workplaces should also consider other ways that you can support workers getting a vaccine, such as allowing them to be vaccinated during work hours or sharing accurate and reliable information from trusted sources, such as health.gov.nz or covid19.gov.nz. And while many workplaces already have the influenza vaccination program delivered on site each year, the COVID workplace vaccination program is more complex. And as a result, both workplaces and providers will need to meet strict criteria and requirements. In terms of timeframes, we are working actively now with Mainfreight and Fonterra, and they're going to be undertaking their test sites in August, and we hope to offer the workplace program more widely from September, probably through to November. A couple of things before I head into a bit more detail around the expression of interest is I've touched on the fact that this is a more complex vaccine. Part of the reason we're looking for larger workplaces is because the vaccine arrives in vials, and we get about 6 doses to the vial. There's 195 vials per tray of vaccine. That's how it comes into the country, and that's the size it's stored in the super cold freezers. That is enough doses for roughly 1,000 people. And we can split those trays into slightly smaller, quite smaller quantities. So 5 vials, which is 30 vaccines, or 15 vials, which is 90 vaccines. So the team at Healthcare Logistics in Auckland, when we get the orders through from every site in the country on a daily basis, are doing kind of almost a reverse jigsaw puzzle engineering process, where they identify how many vaccines are ordered and are coming through in the orders, and then identifying how many trays that they need to take out. Once the vaccine can then be stored at normal cold chain, which is 2 to 8 degrees, for up to 31 days. Those big trays can't be returned to the super cold freezers. So we need to make sure that we do manage to calculate how we split those trays out to minimise wastage. And what that does mean is when vaccine goes out to sites, we need to be working with viable quantities. So looking at both the financial viability of the service, and we will be, and DHBs will be contracting providers on a price per dose, with a minimum viable quantity per day is around about 17 vaccinations per site. And that's both from a financial viability for the provider, but also to make the best use of the vaccines. Now, I recognise that 70 doesn't fit nicely into those maths of 30s and 90s, but vaccine can be stored if it hasn't been drawn up into the vials, from the vials into the syringes. The other thing is, once the vaccine has been drawn up into the syringes and ready to be popped into someone's arm, it has a shelf life of roughly about 6 hours. So that's where we're working with providers, and we need to make sure that there's really good booked appointments coming through and a reserves list and things. So that's some of the expectation on workplaces, is to support your provider to manage the bookings through the National Immunisation Booking System, NIBS, and also to make sure that you have someone on site to support the process and make sure that the staff are coming through, or you've got a reserves list if for whatever reason people can't get their vaccine. And that happens from time to time. Staff might be sick or something else has come up. In terms of the EOI, what we're looking for is we're seeking expressions of interest from employers or workplaces and potential vaccination providers to identify the eligible demand for workplace vaccinations. As I've mentioned, the EOI process doesn't guarantee that individual employers and workplaces or vaccination providers will be able to participate in the program. It also doesn't commit you to participation either. So this really is just the opportunity to pop your hand up and say, look, we're interested. We are seeking joint responses from employers and vaccination providers, and that's ideally sites who have experience of workplace vaccination. Normally that will be flu vaccinations. And so that's ideally what we're looking for in the first instance. The reason for that is that providers, you've got an established relationship with your providers, and B, your provider knows that your workplace, the physical layout and things will be suitable for being able to provide the COVID vaccine. One of the things that's a little bit different between this and the flu vaccine is there is a 20-minute wait period afterwards that has to be observed. So what you'd need to be able to do is ensure that your work site has a space that's able to hold people for 20 minutes while they're observed post-vaccination. And also it's either a ground floor site, or if it's on a higher level of your building, that there is lift access. And this is in the unlikely event that someone maybe has anaphylaxis and requires further support, such as an ambulance arriving or whatever. We need to be able to move people quickly and seamlessly. I've mentioned that we're looking for joint responses. However, where employers or providers are interested but haven't been able to submit a joint application, we will consider that as well. What we will require is that the parties are using the National Online Immunisation Booking System and also the Online COVID Immunisation Register System. And we require that's consistent nationally across both DHB and non-DHB sites. And so what we're looking for is for that to be used, which will require workplaces to have excellent IT connectivity. The other part of that is the workforce who's delivering the vaccine will need to do training in the booking system and in the CIR immunisation register system. And also, if they haven't done training to date, they'd need to be trained in administering the COVID vaccine as well through IMAC. All of that training is available free of charge. In terms of the eligibility criteria for workplaces, we're looking for workplaces who are considered to be one of the largest workplaces or employers by size of workforce in New Zealand and have enough workers per site to be vaccinated. Now, we haven't put hard and fast numbers around this, but as a guide, an indication is workplaces with, say, 1,000 plus employees with the ability to vaccinate several hundred staff per site, or for smaller workplaces or employers being able to support the equity goals of targeting workplaces with high Māori, Pacific or ethnic populations in the workforce, or those harder to reach due to rurality or shift work. Note that even for the smaller workplaces and employers, there is a minimum requirement of 70 vaccinations per site per day. Ideally, we're looking for workplaces who have had a successful vaccination program already delivered on site. So you've had a bit of experience in this space, not with COVID, but with other vaccines such as the annual flu vaccine, and that you're able to provide staff to undertake specified roles and responsibilities, which is outlined in the workplace model planning blueprint, which is available on the ministry website. And there will be a slide at the end of this that gives you the link to that. The sort of tasks that we're looking for is staff that can support logistical tasks to support worker engagement, the callback process for staff for further bookings, and aspects of cultural and religious safety. Those eligibility criteria are in the blueprint and the operating guidelines, which are online. In terms of the timeline, we are working to a really tight timeline, but as I've said, this is just an opportunity to put your hand up to say, hey, we're interested. So the expression of interest was issued on the 9th of July. 12 p.m. on the 21st of July, tomorrow is the closing date for any queries or points of clarification. And then the closing date for the EOI itself is noon on Friday, the 23rd of July. And then what we'll do is we'll collate all of the responses we receive and work with the DHBs and this evaluation team to identify which responses look like they have the potential to go further, which might be better managed nationally through the Ministry of Health, and the ones we're looking at in that category will be workplaces that have multiple sites over different DHB boundaries. It's just much easier to manage those kind of through a single point of contact through the ministry. And there quite likely will be a number of workplaces that are specific to an area. So that could be local councils, it could be particular factories in certain regions, etc. And for those ones, what we would do is work with the local DHB. It wouldn't make sense to manage those nationally. That would be done locally through the DHB and making sure it aligns with their overall plan for population rollout. I have trotted through kind of the background of the workplace vaccination program and where it fits and the expression of interest process quite quickly, but happy to take questions at the end. I'm going to now hand over to Josh Winera, who is an account manager supporting the National Workplace Vaccinations, and will give you a bit more information around, I guess, our learnings and experiences to date from the sites that have been vaccinating in the workplaces for groups 1 and 2 in the sequencing framework, and also the work we're doing with the test sites with Fonterra and Mainfreight. Over to you, Josh.
Ka pai, Rachel. Kia ora, everyone. My name is Josh Winera. I'm the account manager that supports Rachel for this part of the COVID program. Essentially, my role is operationalising the vaccine delivery for businesses and workplaces. What I'd like to do is talk about 3 things to give you a flavour of actually what this looks like on the ground and how we, the ministry, are working with both the businesses or workplaces and the providers. I want to talk about the essential workforce or the border forces that Beth touched on earlier. I'll talk a little bit about the pilot of the 2 large businesses who are currently in the preparation stage, and then I'll provide a little bit more detail around the EOI and also the resources and time that you may have to invest if, in fact, we were delivering the vaccine in your locations. So firstly, the essential workforce. We have 4 government agencies that I describe as live for vaccination rollout: New Zealand Defence Force, Police, Fire and Emergency, and we also have corrections, both corrections staff and prisoners Now that cohort accounts for about 50,000 people. There are two occupational health providers who we have onboarded, and I'll use that term a few times, to actually deliver the vaccine for those agencies. Defence Force and Corrections actually have some of their in-house medical staff, so they're also able to vaccinate. They are currently live. We would be, I would say, close to 2/3 through, maybe even further, those organisations, and they have been part of the vaccination program for nearly 3 months. Looking at the pilots, before we rolled it out nationally for all businesses and workplaces, we obviously wanted to do piloting in terms of some of the learnings, both for our internal ministry systems, some of the learnings from the businesses themselves to see actually if there were any different business procedures or way of doing business in which we could still roll out vaccines in their locations. The two businesses that were selected initially were Fonterra and Mainfreight. And between the two of them, they offered us a number of learnings which we're engaged in right now. They are in the preparation stage. We have been working with both of those companies for the past 3 weeks, and we're looking forward in the coming weeks for the early conducting of the vaccination rollout, which is called a wet run, and then their main sites. From Fonterra, as a large organisation which has many plant working and shift works, that allows us to see actually if a provider can get on site and offer the vaccine to people, perhaps starting at 4 AM or 7 PM. Now, this is not really attractive or actually good use of resources for some of the DHBs, but a provider may be able to go in there and actually set up on site. Fonterra also has a large national footprint, so this allows us to actually work with a single provider who can cover all of the sites. As Rachel touched on, there are some businesses that may be centred in just one region within a DHB region, and in fact, when we go through the EOI review, it may be better that they are locally commissioned for your vaccination through the DHB. But for businesses that have a national footprint, we have found with Fonterra and Mainfreight that actually there is a preference to work with one provider rather than multiple DHBs. In terms of Mainfreight, they also give us some insights, and we're also piloting bringing in their whānau into the site that's set up by Mainfreight. And we'll see how that learning goes, because there may be some questions about bringing in whānau and family to your workplaces, but we're actually going to see how this piloting goes. The difference between sites, though, actually will dictate whether it is actually feasible and safe for families to be brought on site. In terms of Mainfreight, they're going to have a large area which is actually not a factory kind of site for whānau. The other thing that we're learning with Mainfreight is actually scheduling of the workforce. We have Book My Vaccine, which is our principal tool of which New Zealanders can self-serve themselves to book online for their vaccine. But we're working with Mainfreight and their team to see how we can actually schedule when the workforce take up their vaccinations. What we're learning through that, for the example with Mainfreight, is what they don't want is all of their forklift drivers, for example, all booking in unknowing to Mainfreight headquarters. And then if all the forklift drivers are on at the same time, that will obviously have an impact of loading trucks and productivity. So that's some of the learning that we're getting out of Mainfreight and also with their whānau. As Rachel mentioned, we've also got the Warehouse and Fisher and Paykel group, and there's some separate learnings out of them. Finally, I just want to touch on the expression of interest and what actually the operationalizing the vaccine in your workplaces would look like. Well, firstly, the ideal submission we would receive is one from a workforce, business, or perhaps a cluster of businesses that has already a relationship with an occupational health provider. What we would do then is we would look at the size of your sites, the amount of people you have, and that's one half. Secondly, we overlay the capability and capacity of a provider on top of that. From that, we get the vaccine schedule for your particular workplace. Now, you may be spread across a region, or you may be spread across the country. And so it depends on the capacity of the provider, whether they will get to those sites sequentially or concurrently. What we're going to do is after the EOI has finished, we'll be able to put on a master Gantt chart and scheduling all the businesses to make sure that actually we have coverage of everyone. In terms of time, when we identify the workforce or the workplace and the sites, we overlay with the provider and their capacity. If the providers haven't actually been in the COVID program to date, then we will need to onboard them. And onboarding means that we have to make sure that their staff are adequately trained to administer the vaccine. We have to put them into our system, our reporting system and digital system. And we also need to make them conversant with the booking system. And then we finally have to put them into our logistics system for where the vaccines will be delivered on site. Essentially, that process takes about 2 weeks. We would then look at how long it would take to vaccinate on your sites. For argument's sake, let's call that another week. There is then 3 weeks between vaccines, minimum between first and second dose, and perhaps the second dose delivered over weeks. So you can see through that kind of equation, from the time that we are identified you and a provider and we onboard them, that could be up to 6 weeks. As Rachel touched on, there's a few things we're looking for the workforces to do in terms of supporting this. Fonterra, Mainfreight, large companies obviously, but they have created a small project team as well. So that means myself working with the project team and also the provider. And on the day of the vaccinations, they're also providing people who will sort of marshal the workforce, make sure people are there where they need to be. Because for the provider, the vaccinators, we really want to maximize their time to be able to deliver the vaccine itself, which I've said before today is probably the most unremarkable part of the whole process, about 15 seconds and then some observation time. But that's just the sense of flavour of some of the large workforces that are live, workforce being vaccinated, preparation with our 2 pilot businesses, and some information about the EOI and what it would look like for you, the businesses, should you be part of this. With that, I'll conclude and I might hand back to Kirk, I understand, if we go to Q&A. Thank you, everyone.
Thanks very much, Josh. And also thanks, Beth and Rachel. We're just waiting for a few questions from inquisitive businesses that are online, as always. I've got a couple of questions that sort of relate to, if you're not a successful business in the EOI process, where do employers go for information about what they can do or contribute, or in terms of information for their own staff about the vaccination process that might play out, so they can kind of, I guess, help inform their workplaces about what's going on and why it might not be happening in for example, their workplace.
Yep. I'm happy to answer that, Kirk, if that's useful. There's probably two parts to the answer. One is that as DHB's rolled out into Group 4, there's going to be a lot of national advertising and communications, and then DHB's locally will also be promoting their sites. A lot more general practices and pharmacies are coming on board. And what they will be offering is obviously there'll be community centres, there's going to be some mass vax events. So there'll be a whole range of ways that people can access the vaccine. That's part one of the answer. Part two of the answer is we can send the links, and if Business New Zealand is interested in sending them out, to where there's more resources and material and collateral. So even if your workplace isn't going to be a work site for vaccinations, you're really welcome to use any of the resources we've got in terms of frequently asked questions or posters, etc. Put them up in staff rooms, run videos in staff rooms if that's useful. We can provide you with the suite of resources to do that.
That is brilliant. Thank you. We'll take you up on that, and we'd be happy to receive those links and send them out to people. We've got a couple of really good questions here, actually, and they're a little bit linked. So question here, what did Rachel mean by joint responses being welcomed? So that's one question. And then do we reach out to our current flu vaccine provider? Do they lodge the EOI, or do we? So a couple of questions there.
Great. And thanks, Erin, for the questions. So yes, the joint responses would be a response from yourself and your current flu provider, or flu vaccine provider. And in the EOI form, there is space for you to both fill in some details there. It doesn't really matter who sends it in, whether it's the workplace or whether it's the provider. That would just, between you and your provider, you could agree who does that. So it's a pretty straightforward form. It shouldn't take long to fill in. The information we largely need is kind of where you are, what your workforce is comprised of, etc., and just obviously the details from yourself and also your flu vaccine provider.
Excellent. And so another question here, which is, I think, really interesting. Are you interested in employers that have CBD locations as a possible central hub for city workers?
Great question, Sarah. So one of the options we haven't touched on is that if your workplace isn't kind of a really large workplace, there is an opportunity that we'd be looking at where we could be interested in multiple workplaces who are in a site. So there might be a building with 5 or 6 different businesses in it, which would then give you a viable size. So that is an option. What we would need in that case is a lead organisation to kind of run the process, and the other part of that would be a single vaccination provider across all of those sites. So, so that's an option in terms of a CBD offering. In terms of I'll start slightly different place on this one. In terms of the value that workplace vaccinations have is that it is on site and it's not requiring people to go to another location. So having I guess a CBD location where workers could go to, that's more kind of what the DHBs are doing. A lot of them in Wellington, for example, Capital and Coast DHB has the vaccination centre. Gosh, now completely it's down in Thorndon. Can't remember the name of it at the moment. It's completely slipped my mind. And for example, Auckland has them as well in a range of sites across the city. So the DHBs already have those locations where people can go to. I think the real value of a workplace vaccination site, whether it's for a single business or a single entity or a number of businesses in a single building, is that it means the people aren't having to, your employees or the employees of the businesses aren't having to travel to somewhere else.
Cool, thanks. We've got a few more questions here. Actually, they're coming in thick and fast, I might say. So here's a really for employers. This is a question that they'll probably want to understand before they put their EOI in. So if you have vaccination on site, who is the responsibility if the employee has an adverse reaction? The Ministry of Health, the DHB, or the employer? So obviously trying to limit the employer's exposure there. But could you maybe just have a crack at that one?
Yep. So the like your flu vaccine, it's exactly the same. The vaccination provider, so be it occupational health or pharmacy or whoever, they are the health professional who is delivering the vaccine. So they are required to follow the same process for a flu vaccine or any other health event. So the employer is not the responsible party. The vaccination providers, just to give you a bit of background, need to make sure that they have a health provider index number. They've got experience with delivering a successful vaccination program. They have a workforce that's fully trained. They need to comply with program standards, service specifications, the immunisation handbook, operating guidelines, including having existing cold chain accreditation, active clinical quality safety oversight mechanisms, mandatory use of the national booking system, and the CIR, so the immunisation register system, so that it's all the things that would be expected of them at the moment for any other workplace vaccination program.
Thank you. And so I think Josh has sort of covered a little bit of this off in talking about the main freight and the Fonterra examples, but a question here about what support will be provided to workplaces to enable them in participation, logistics, equipment. Will workplaces need their own vaccinators, for example?
Thank you, Kirk, for that question. Look, I guess the initial part is working out with the business if they can put together as a lead person or perhaps someone to project manage from that business, and then the provider. In terms of what we call collateral, which is setting up the site, we have a number of resources which we can provide that to both the provider and the workforce. The key thing that we're looking for the workforce actually when it comes to the vaccination event itself is actually managing the staff flow and people to come through. But as Rachel touched on, there's a lot of comms material which we will put out prior and we give access to. But really the site setup is important for a workforce that might have an existing provider, because actually that provider will know the business. It'll certainly know the people. It might know the layout of the site itself. So we haven't got a model that fits all, but when we get together perhaps a little project manager, myself and my team and the provider, then when actually we scope in detail at that point. I hope that might have answered that question in some way.
I think that's great. But look, it's a slightly related question, actually, Josh. When will the main freight trial results be known, and will they be available? I mean, will they be available to share in terms of the learnings and so on?
Absolutely, absolutely. One of the conditions, actually, obligations of being in the pilot is that we could share the lessons as we go with both Main Freight and Fonterra. Initially, we were thinking once the whole vaccination process was finished, we could have webinars from them, but actually that's too late. So we've decided actually we'll have a webinar where Fonterra will lead it, supported by Main Freight and the Ministry, and we're organising that right now to talk about the preparation stage and how they organise themselves with the provider, their sites, and maybe even scheduling their workforce. A month later, and so we're talking towards the end of August, perhaps early September, before we have the main rollout. Main Freight will give insights into what it was like actually operationalise and putting their people through, supported by Fonterra. So we're flipping it between those two organisations, and you'll get an opportunity. And once we have the learnings from those two phases, we'll actually probably put out through as many channels as we can for businesses, and actually it won't be just us, the Ministry. You'll hear from both their project managers and the providers of how things went in the preparation and actually in the delivery live stage.
That's great, thank you. Got probably two or three more questions here. Here's one I think you may have answered, that it might not be possible due to the complexity, but the question here is, are you interested in buddying workplaces up, e.g. small workplaces in the neighbourhood coming on site if a large organisation was to go ahead? So, you know, a series of businesses, say for example in a large-ish suburb like Mount Wellington, so joining into another business's vaccination program, is that something you'd be thinking about?
Yep, absolutely. So an opportunity there is if you've got somewhere like an industrial park or something like that, and a number of businesses, that is a conversation that we've started having with Main Freight around whether we'll just vaccinate the Main Freight staff or open it to some of the surrounding businesses as well. So yeah, absolutely happy to have that as an offering, particularly if they're workplaces where people might struggle to get to a DHB vaccination centre.
Presumably, would that have to be part of the EOI, or would you consider it after the fact?
Oh, good question, Kirk. Ideally, we'd like it signalled in the EOI, but you know, you wouldn't have to have everything signed and sealed at this stage. But you could say, look, this is our business, this is how large we are. However, we've got, you know, 10, 20 businesses around us, so we think we could pull together potentially X number of people. Just something at that kind of level would be sufficient.
And presumably, I think as Josh said, if you're kind of operating shift work outside, you know, if there's a range of those businesses operating shift work outside DHBRs, then that, you know, that is information that might be useful in the EOI.
Absolutely, yeah, that would be awesome. So some sort of a little bit of information around your workforce. We don't need to know that you've got 73 of this particular population or whatever, but you know, just saying yes, it's a shift work organisation, it's a 7-day-a-week organisation, that you have high Māori Pacific in this part of your workforce. That sort of thing's really useful for us. So I think in terms of thinking about seasonal businesses which are coming online in kind of late spring or summer, this is
this is an interesting one, because you could imagine that there may be quite a lot of people, involved in specific sites or a series of sites. So the question is, what timeframe do you have in mind for the completion of workplace vaccinations? And I suppose that's related to the Group 3, Group 4 rollout, but I'll leave you to answer that.
Thanks, Kirk. So in terms of seasonal businesses, it's a great question, and there's some opportunities here. Group 4, which is the general population rollout, bookings are open, well, it's beginning to be opened up from the end of this month. It is being implemented in age bands. You may have heard about that. So kind of dropping 60 to 65 and then moving down to 50s, 40s, 30s, etc. Recognising that workplaces are a mix of age of people, and what we're trying to do is kind of hit that sweet spot. So around when the 30 to 50-year-old age group are going to be brought on board, recognising there's people under 30 working and people over 50 working as well. There is no expectation in the workplace that you will have to do that age banding. We will be vaccinating everyone in the workplace at the same time. But what we are trying to do is hit that kind of September to November timeframe, just to line up as best as we can with that age sequencing that comes in. In terms of the seasonal businesses, I think that's probably a fantastic opportunity where people are coming together in a particular seasonal business to offer vaccinations. With the Fonterra test site, it's the opposite issue. Milk season starts in earnest late September and into October, and so what we're working with them to do, and that's when they become a 24/7 business, we're looking to vaccinate their staff before they hit that peak milk season, because actually they'll be too busy to vaccinate. But there is the opportunity where if you've got staff that come together for a specific purpose at a specific time of year, that is a really nice opportunity to vaccinate as well. So there's two sides to that coin.
Nice light one to finish. I really want to thank you guys for your time. I hope we've got a lot of really useful information that we'll be able to get out to members. Nice light one to finish. Do we need to provide our own fridge for storage? There you go. There's an easy one for you.
I could be really cheeky and say only for the beer and wine. But no, you don't need to provide your own fridges. Your vaccination provider will be bringing the vaccine on site in accredited chili bins, and they will then be taking vaccine back off site, etc. So they will completely take care of that for you. You don't need fridges or any of the other stuff. So they'll be responsible for all of what we call cold chain.
And I presume, much of that process would be worked through post, the assessment of the EOIs, and once you've made the assessment about the businesses or the series of businesses that might be involved, then they will run through the relevant processing steps that they need, as sort of Josh outlined. So, hey, thanks again for your time today. As I said, some really great, useful and timely information. We'll get that out to our members, given that the EOI process is closing on the 23rd of July. No late entrance, apparently. So we'll get that out. Thanks again.
Thank you, and thanks to everyone for participating. Thanks, special thanks to Kirk and the team for supporting and hosting this.
Thank you.